I think AI is going to be an essential part of making amends for some of the wrongs that have been occurring in our health system for a long time.
All right, welcome everyone to the Brainiac Blueprint. Today's podcast is part of our healthcare series. We are being joined by Emily Olson. Emily, how are you today?
Doing great, thanks. How are you?
Doing great. Ready to get this conversation started. So just so everybody knows, you are the head of clinical operations at Braided Health. Would you mind telling us a little bit about Braided Health and what the head of clinical operations does there?
Sure. So Braided Health is a tech-enabled services company. And for those who aren't in the industry, what that means is that we're combining knowledgeable people with innovative technology and AI to create a better experience for everyone, all stakeholders. So that means the insurers, the patients, as well as the people who are caring for those people. There's a really beautiful place where all of that can intersect, and it's a triple win type situation.
I love that. I think it's easy to focus on just one of those, making sure the patient's okay, or like the hospital or your system, whatever it is okay. But it's nice to kind of think about that full picture there.
Yeah, and not only is it nice, but I think it's actually necessary, because what we find is these types of things, when they're sort of unidirectional, can look great on paper. You
Yes.
often hit a wall when, the team can't use the technology, or the patients aren't interested or getting what they need. And so while it can be very enticing to focus on that little slice, what we quickly realized is that that's sort of the origination of a lot of the problems that exist today. So it's really necessary, although it does take longer to accomplish, for sure.
100%, but I feel like it's going to be more sustainable, right? If you're kind of thinking about all the angles, you'll have maybe little obstacles to overcome versus some major existential thing. It's like, oh God, we're not taking care of this whole part over here. So
exactly, it's a long-term play for sure.
Awesome. I love that. Well, I love that you are, thinking about AI and you guys are tech enabled and everything. So I think that leans perfectly into, our podcast and our conversation today. So very open-ended question. Emily, if you could just say, I think AI is, and then fill in the blank for me.
Sure. I think AI is going to be an essential part of making amends for some of the wrongs that have been occurring in our health system for a long time. So, and I say that very carefully, because I certainly don't believe that means we should have AI taking the places of nurses and doctors and social workers, etc. But I do think there's a lot of really wonderful things that AI can help us do, and do faster and with less emotional labor than it would otherwise take. And so I think it's a key ingredient, but I do not think it's the whole recipe.
I love that. My whole mantra for all of my AI work is human empowerment versus human replacement. So I think that, I think we're kind of on the same wavelength there. It's an appropriate mantra to have, I think.
Absolutely.
Love that. All right. So before we jump into a lot of AI specific stuff, you and I exchanged some emails, and I think some of the information that was in there was very interesting, and I liked a lot of the wording that you used. So I want to kind of jump into some of those topics, and I think that'll lead the conversation nicely into AI and healthcare. But one of the things that you had mentioned was being a professional translator of "this makes sense clinically" into "yes, the CFO will sign on it or sign off on it." As a marketer and a service provider, I feel like I think the kids are calling it code switch a little bit, depending on who you're talking to, so that you can speak their language and really get your message across. So I was curious if you have a secret sauce specifically for that CFO to say yes, or even if it's to get them just to not say no immediately.
Yeah, interestingly, I have a very specific approach that I use when thinking about designing a care model. So who are the stakeholders? What are their inherent interests? So instead of trying to convince someone about the things I care about, either as a clinician or as someone who's pitching to, say, the CFO in this example, I think it's really important to to think about what things do they already care about and how do the things that I want to accomplish overlap with that. And in the psychiatric world, which is where I come from, that is called motivational interviewing. And I use that in my daily life. I use that in my work life across both my work in care model design as well as when I'm pitching to an audience. So understanding in the CFOs shoes what is important to them, which is budget and making money usually, or saving money. Those can be opposite sides of the same coin. And then thinking about, now, how are the things that are important to me and important to a member or a patient? Where is the intersection? And I find that's the easiest. I think early in my career, I would often try to change the script more dramatically, but then it kind of backed me into a corner, because what if you're talking to an audience that has all of those types of people? Or how do you think about a website that many different perspectives are doing? And so finding something that's true and has legs to each of those different stakeholders has really been the approach that I've taken. And I think that has been, it's not perfect, because sometimes I use language that's not necessarily recognizable immediately to everyone, but I think it's the one that, again, when we think about that sustainability and how do we have principles that I can not worry about who exactly is in the audience and know that there's a piece in there for everyone and something that is going to be relatable.
That makes perfect sense. And I think you mentioned, got to find that sweet spot, of like who they are, what they care about, and what you're going to be doing to kind of help with their goals as well. As someone who's worked in healthcare, just from a marketing standpoint, I certainly don't know the ins and the outs, like someone like you would. But I know that with some healthcare, there's a lot of ego that can be involved, whether that's because people have been very successful in treating and caring, or they've been building their business and everything. So I was wondering, how you deal with the emotion of it all. Because again, you can go to a CFO and be like, hey, we're going to make you X dollars, and that speaks, right? That's very clear. But there's also an emotional level to this all. And I'm wondering how you might deal with that a little bit.
Yeah, so I think there's emotion on both sides. Like, I am very invested in what we're doing, and I think it's a really important piece of sort of making moves and change in the healthcare system, again, to this idea where everyone wins. And so it's hard at times not to take it personally. But I think the other thing is, when you are invested, emotionally in something that requires a lot of change, that can be really difficult for those that have to change for a number of reasons. Anytime we're saying what's happening is not working, not only are we talking systematically, but we're also talking really about everyone who's participating in that system. So even when people recognize, I saw this a lot in my work in value-based care, when people recognize, yes, it makes sense that we should align finances with outcomes, it also meant a very material shift in paradigm and how people think about the work that they're doing in their place, and maybe something that wasn't the best. And so I actually saw often that piece, and not ego in terms of I think I'm best, but ego as who am I as a core person. I entered, especially when you think about caregiving professions, usually people have entered it because they want a better experience. They want to do something better for humankind. And so coming at them with good intention, there has to be a lot of inward reflection and willingness to critically look at what did I do before I had this information, and what could I do differently now that they have that. And then there's just kind of the second piece, which is really just habit. I've been doing something, I've been commended for how I've done that for 35 years. Now I have to change that, and that's very difficult as well. So I think those are probably the two biggest places that I see that concept of ego come into play.
I love that. And I think habit and change and the whole paradigm shift is so important in a lot of ways. And I think especially when you're bringing something like AI, which is obviously a huge paradigm shift, but comes with a pre-built-in reputation, right? People have an idea of what this means, and it's hard to, whether it's true or not, they just have this idea. So I'm wondering if, regardless of the stakeholder, when you talk to them about, AI or some new initiative, if you've kind of gotten like laughed out of the room or gotten some obnoxious reactions from anybody in the past.
Not laughed out of the room. I think the most interesting response I got was, well, this is too good. We don't want all this fancy stuff. We just want to do the most basic thing, which I thought was really interesting. And I think there's a couple of pieces specifically related to AI and the idea that if we let a little bit of this in, is it going to come for our jobs and are we going to replace? And I think that's a real fear and an understandable one because there's been a lot of projection about that. And so I think it's really important for people who are using AI to understand and develop sort of a firm set of principles about how are we going to use AI? What is the limit? Where do we think? And you mentioned this earlier, but something we say a lot is we want to use AI to enhance, not replace the human connection. And thinking about AI, we often think about it in data and analysis, which is great, but we're also using it in a way we're saying, hey, remember Miss Jones has 4 cats. Those cats are like children to her. The most important thing in her life is staying home so she can take care of those cats. Or remember 2 weeks ago when someone from our team had interaction with her, she talked about her grandson's birthday party and how important it was going to be for her to be able to attend because she was in the hospital last year. And not only do those things make people feel good, but then we're able to really tap into the intrinsic motivation that I was talking about before. So we may want Miss Jones, or the CFO may want Mrs. Jones to stay out of the hospital because it's incredibly expensive. Miss Jones wants to stay out of the hospital because she wants to stay home to take care of her fur babies. And what you can, if you just take a little step back, you realize like, hey, everyone wants Miss Jones to stay at home. And that's the thing that's really exciting. And that I think AI is a novel way that we're using AI kind of outside of the typical way we think about it.
I love that. It's such a simple concept, having some empathy and being like, I know you want to spend time with your cat, so this is how we're going to help you. Like that resonates so much. That shouldn't be that complicated, right? But
and it's not, but it's just, again, it's opposite of how we're all trained. We go in, we say what the goals are as healthcare providers. We are supposed to know the answers. We're trained to address symptoms, not necessarily people all the time. And so it makes a lot of sense as to why it's so hard, even though in concept, it's very simple.
Absolutely. Well, I think that's all a really nice segue into the next kind of core concept I wanted to discuss with you. And again, during our exchange, you had mentioned that you have some joy in untangling the delightful chaos. And I found that saying to be so interesting. It really stuck out to me. In general, I like a lot of the words that you use. They felt very purposeful. And so to me, it felt like there's a bit of a joy in the seriousness of it all and the craziness of it all. So I'm wondering if this is an intentional mindset that you have. And if you have ways to kind of, control, again, just like the emotion that comes with chaos and that comes with healthcare and, how you handle all of the nuttiness that might be there.
Yeah, so I think it's a little of column A, a little bit of column B. I think by personality, I am a dopamine chaser. And so I think there's a little bit of that just kind of drew me to that. I enjoy things like escape rooms and puzzles and anything like that, or, doing arts and crafts with my hands. So I think there's that personality trait that I kind of literally like looking, at a pile of yarn, for instance, and being able to create a scarf out of it, or, figure out the ins and outs of the escape room. And I think that actually translates really well. And I talk a lot about the startup world with people because I think people like me tend to be drawn to that world because it is very much like that. There's this huge realm of possibility. There's not a guidebook for it by any means. And it's where innovation can occur. But to your point, that's absolutely also on the other side of that is it's unpredictable for sure. It's a lot, you have to be incredibly agile and dynamic. And yet also understand when do you hold tight and not pivot because you don't have an information. And I think, there's no one way that you sort of deal with that stress. I think obviously having supportive social circle, family and friends, and also working with people who are just as devoted and maybe insane as you are is also really important. And you tend to find those types of people in the startup space. But I think it's really important to keep that mindset and sort of also have really deep rooted conviction about what you're doing, which is it can also be a blessing and a curse, because then those hits fall harder when you're that convicted. But you have to kind of have that anchoring to kind of help you ride those waves that occur in this type of space and in health in general, frankly.
What is your conviction? What is your why? Do you have a specific, or are you just drawn to helping people, or is there
no, I mean, I probably should say that, right? I'm a nurse. That should be my answer. But I mean, I love helping people. That's true. But I think I like it's the challenge of it, and knowing that there is a better way, and that I've worked in spaces where it's worked financially too. So having kind of that history, this is my third serial startup. Worked in a very successful one right out of kind of my first experience, and so saw that it is possible to kind of create this space where everyone wins. And we don't like to talk about money in mission driven work, but at the end of the day, it's how we can do the work, right? None of this stuff happens for free, and so you kind of have to flip the script there and understand, how do we make money in a way that doesn't feel shitty when we go to bed at night? And I think that's really crucial as well.
I always tell my clients, whether we're talking about marketing or AI, especially a lot with marketing, that you can't go to the bank with a bag full of leads, right? Like you need to be able to treat these people and actually have dollars to be able to continue to help them. So it is that uncomfortable conversation, but it's a necessary evil, unfortunately, to be able to do the good that you want to do. So
absolutely.
Cool. That's some great stuff. I love that. I love that we're talking about AI, but we're talking about people a lot, and making sure that we're staying focused there. So I think it's a great theme. And, you had originally mentioned, I think you called it the invisible work, the emotional labor, the systems, some of the unpaid roles that are involved in keeping healthcare together. So what's some of the stuff that's behind the scenes that a regular individual like myself wouldn't know, that you want to kind of shine a light on, that helps you and the patients or the business, whatever it may be?
Yeah, so I originally came across this concept in an article that was talking about how women often take on a lot of emotional labor. So not necessarily like doing things, but planning, being aware, when do kids need a doctor's appointment, when are bills due, a lot of these different things that are not outwardly necessarily tangible or visible, but that take a toll on the stress. They might be the things that are causing insomnia or causing you to be irritable. And I loved that concept, because I always felt like, in my own marriage, if you looked at the chores that are done in the house, it would be very easy to say, oh, my husband does all of that. But then I was like, but what am I doing? And so kind of reflecting on that. And that really came to play when I thought about the teams that we're supporting now and I have in the past. It's not just, I have to take care of this patient. That's what most care people know how to do. But it's, I have to take care of this patient. I have to remember what insurance they have. I have to remember what benefits they have. And if they have the benefit, I need to know how much they've spent towards a threshold, if there is one, or I need to know what their personal goals and philosophies are, or I have to remember what this thing is that the policy or the workflow changed last week. And like, at the end of the day, it's not possible. And so that's kind of where we thought this is a really unique opportunity to take that burden, because that burden is actually not helping. And that's a very clear example of where AI can actually be much more effective in addressing those things, being a virtual memory vault, being able to automatically redirect workflows when they change. And then the care team member is really spending their time on what they want to and what is going to be most valuable. It's that relationship, it's decision making, it's about placing values on different outcomes, none of which AI is the best at today. And so that's another place where we create that win-win. the ability to leave your work at the end of the day and then enjoy other things in your life, which all of us are chasing that, but this is a step towards making that a reality, because I no longer have to have worth 100,000 sticky notes, because the system knows it's going to alert me when something's falling through the crack. And it's also going to alert me to those people that I don't even know who are falling through the crack, who are demonstrating patterns in data that I would never have the time and or necessarily the skill set as a nurse. I'm not a data analyst to do that or look over 10 years. So that's why that's kind of been a hallmark and something that's really important to me, both as a woman and a former case manager. That resonated very strongly with me.
I mean, nobody is successful without other people, right? And everybody needs to be working together, working in lockstep, kind of building each other up. So I love that you're thinking about that kind of stuff. I'm curious if you've implemented any kind of models or workflows or anything like that in your day-to-day that helps you to accomplish that, or at least mitigate some of the issues that might come.
Yeah, so just things like having an AI note taker that will ping me about follow-ups, so I can really be more present in a conversation, yet not have to worry, like, did I miss something? Did I am I going to do what I said I was going to do? And that actually became sort of the model for a lot of the work that we're doing in our platform as well. It is saying, okay, if you're already doing the work, can't we just create a system that captures that without you having to go back and then remember what you did, appropriately document, make sure you're meeting all the criteria of the different credentialing bodies or regulatory bodies, etc. So that's a very simple example, I think, of using an AI note taker. And then I do a lot of bullet journaling as well. And so just lists and things that sort of like release the need for me to try to keep everything in my mind at once.
That's great. I love that. I don't know if you, not to plug Google here any more than they need to be plugged, but if you haven't tried Notebook LM, give that a shot. It's a great way to just throw all of your notes into a list and they'll kind of digest things for you. It's very, very cool.
Yeah, I have not. I'll just plug it because I have no association with them, but Read AI is something that I actually was introduced to through Google Meets. And that was that kind of like planted this seed that I've run with and our product team has run with.
I have Read hooked up to my Google Meet as well. Yeah, we're on Zoom, so we don't get it today, but cool. So I want to take a step back from your day-to-day in terms of just normal operations and kind of focus a little bit on care and coordination of care. I think that everybody always has this immediate reaction of healthcare sucks or helps out some, or there's an immediate reaction in a lot of ways. But I think everybody can agree that everything can always be better in some way, shape, or form. So I'm curious if you have any tangible examples of, how you think coordination of care and everything might be improved in the near future, especially by implementing some of the concepts that we've talked about with AI and automation and things like that.
Yeah, I think the biggest barrier to that today is the siloed data. So coordination by nature requires that you understand, what's happening on the other side of the fence. And our biggest barrier today is it's no longer, in my opinion, that we don't have the data we need, but if you don't have the data next to the other data next to the other data, you're not getting the full picture. And so we often think about trying to manage someone with only seeing like half the picture or having it very blurry. So you have a general idea that there's a human here, but like what makes that human unique, and therefore how we need to address whatever issues they're dealing with. That's like where we need to get to. So the biggest thing is, how do we get all that data in one place? And then how do we make meaningfulness out of that data? Meaning, when we have that data, how do we make sure that however we're presenting it is actually actionable? So just being aware of the problem is not enough to fix it. And I can use an example of, we know someone that went into the hospital for fluid overload, right? But there's 10 different ways that fluid overload could happen. It could be poor diet, not meeting hydration needs adequately. It could be disease progression, which there's a million other reasons. It could be not taking your medication in the right way. And what we do about that really we need to understand the how come behind that. And so that's where, kind of connecting all those pieces, having the data, using AI and analytics to create the what's happening, how come, and what now type answers, and then surfacing in a way to the care team. Like all of those, there needs to be a single thread that connects all of that. And, most of the time, you don't have all of those players in the same space working on the same platform. So that interoperability, not only that we're exchanging information, but again, that we're exchanging the right information, that the recipient is only getting the right amount of information so that it's specifically the information they need to impact their care with their licensure. So, a lot of times we will fax 40 pages of narrative notes to the PCP and check the box in terms of care coordination. But, just like everyone else, PCPs are overwhelmed today. And if they have to go hunting for 25 minutes, which they don't have, to find that one nugget, it's not worth their time. So we need to say, here's half a page that's digestible in 30 seconds, and it's going to say exactly what you need to know. Like, they're not taking their medication because of the side effect. That may be a conversation you want to have. And again, all of this, we are really focused on surfacing information so humans can make decisions versus making decisions for the humans. And so it's more like, hey, did you notice this? Were you aware of this, or did you forget this? Type nudges that we're using in our system to really connect that and make sure that everyone can see the full picture and more specifically knows what their role in meeting the outcome is.
That's great. That's great. I can already see how it cannot all, play together and make things, work a little bit better. One of my immediate thoughts though, and I'm curious, this is a bit of a specific segment, I guess, in healthcare. It's one thing to have like a platform or an app, whatever it is that has this information and is sent to the provider and is empowering them, throughout the process of care. I'm curious how you think things could be improved from a high stress in the moment. I'm thinking like surgery or ER, ICU type of like moment. Have you seen anything that might be, included in that when it's just like, I need to make this decision now. I have 5 seconds or 10 seconds. How can AI help me to make that quicker? I'm wondering if you have any thoughts or instances around that.
Yeah, so I'm having a little connectivity issue, so I think I heard the question, but please redirect me if that's
Sure.
An error. But I think what I heard is a lot of times we don't have time to pore over things, or like there's decisions that need to be made in real time. And I think
Yes.
The biggest progression forward that I see right now is the ability to take real time conversation, digitize it, send it through an LLM, and you can get back responses in 30 seconds or less. So, if someone's mentioning some different symptoms of depression, that might cue, hey, it might be a good idea to do a depression screening. Or if they mentioned that they tripped and fell outside MoneyGram, that might be an opportunity to think about, do they have some financial instability? And even further than that, AI can help us think outside the box, and maybe helping someone get a bank account isn't within the normal realm of interventions. However, it could have the ability to take that fixed income that they were siphoning a portion out to pay for check cashing, and now they may be able to afford their medications that they weren't taking. And so all of these have really important effects, to your point, that need to happen in real time. So there's that piece, as well as just sort of behind the scenes prompts that we know when this action happens, this one should follow. And so it can prompt in that way as well, which is not dependent on the transcription, but can be rules based. So there's all sorts of ways that people can be helped in the moment. And I think the biggest thing is there's a million different ways or prompts that could happen. And so keeping it narrow enough that we're not, flooding with 1,000 prompts per minute that just get lost in ether, and really thinking, what are the main things that we want to pull out of these or bring people's attention to, and how do we direct the model to that so that, again, it's digestible, it's not distracting, which is the opposite of the purpose of these types of things. But I guess that's my short answer.
I mean, that's a perfect answer. And honestly, I got a little giddy kind of listening to you there. Like just thinking about, again, real time going to an LLM and talking to them and having them, kind of help the situation is so interesting. And I mean, even 10 years ago, I think we would have been like, what are you, like living on Mars type of stuff, So
Right.
I think that's so interesting to think about. And it's going to be very, very crazy to see in action. And even like, again, you're just talking about the bank accounts and like all stuff that you don't necessarily think about with, with healthcare. It's crazy to see it all kind of come together from an expert like yourself. That's awesome. Cool. So, wanted to jump in, talking about patients and, everybody's individual kind of situation, and how AI obviously can help you learn with a lot of that stuff. When you and I were going back and forth, you had talked about cultural competence, and how, that we can be competent in someone else's culture or not be competent in someone else's culture and what to do. So I was hoping you might be able to elaborate on that a little bit. And like, are you speaking specifically to differences, related in healthcare related to like their race or, where they live and genetics and things like that? Or is it something else, that maybe I missed the point there?
Yeah, really, it's all of that.
Okay.
And my anyone who's followed me at all on LinkedIn know this is kind of like my soapbox topic, but I think the idea that you can be competent in someone else's culture is heinous. What I do think is that you can be culturally sensitive, you can be culturally curious, you can be, but what I think I think the biggest reason that I'm so opposed to this idea is instead of us just saying, maybe we don't know, and let's just ask the person what their preferences are, we pretend that by knowing someone's race or religion or culture, that we are going to make assumptions based on that. And that just feels pretty dangerous to me. And It feels like the long way around to what we really need to know is more important than their culture is what pieces might they take from it or not take from it. Everyone interprets culture, religion, race, all these different factors differently. And so the easiest way to do this and to get it right is to ask the questions and allow them to give you the answers. Then we're not making assumptions. Then we're not guessing. And we are going to the expert who is the human who we're talking to get the answers. And I think for so long, we've been so afraid to ask those questions that has prevented us from doing the right thing and the easiest thing in doing that. And then, it also, you can really damage a relationship by making incorrect assumptions. And that it can be so hard to come back from. But if the person that is receiving the treatment is telling you how do they want to be communicated with, what procedures may they or may not align with their religious or other types of beliefs, what are their goals? Those are questions that are very simple to ask, and then it prevents you having to go in and make repairs, because if and not to say that means you get it perfect, but it's a lot better than trying to guess on based on some curriculum that you are required to do 6 hours of training in, that maybe like highlights one racial or ethnic group or these types of things.
I mean, we all have our different biases just from our own life experience. So, you want to eliminate that as much as possible. I think that ties in nicely with the conversation we had earlier about talking to your CFO. You can speak their language because you've already talked to them. You've had questions with them. You know what their goals are and things like that. So that way you can speak their language. Well, similarly, you can help diagnose and treat somebody only by asking these questions, not by making some assumptions. So I think that is just a perfect way to approach it from a non-healthcare person, as a marketer and AI person. But I love that you think about that kind of stuff, and I hope that becomes more common, just in general. So, I think a similar concept that occurs in healthcare a lot is stigma, and stigma with a lot of specifically like a condition-based stigma. So I'm curious if, you see similar use cases or how you might approach something with a touchy subject, to help treat that patient and also, empower the conversation or the treatment with some AI.
Yeah, I think what's interesting is, as being a psych nurse, stigma is something that you think about all the time, because especially when I started 20 years ago, that was something, even more so than now, I think was intensely stigmatized. Reaching out for help was not necessarily seen as admirable or brave. It was seen as weak, that kind of thing. But I think, stigma in healthcare goes far, far beyond that. And I think what's really important, and that we have made some strides in doing, is stop labeling people as their diseases or their attributes. And this is where I think about the mini, whole person health really comes into play, because someone is not just depressed or a schizophrenic or a diabetic, right? They are someone who didn't have access to quality food when they're a kid, and because of that they became overweight, and then it was hurt on their kidneys and they ended up with diabetes, etc. And I think when we stop looking at someone as their disease state and start understanding what the factors are, twofold. It just automatically reduces stigma, because you're thinking of someone as a human versus a disease. But second, it really, again, goes back to something we've already talked about, which is like understanding what to do about it. So if you understand that they are overweight because they don't have access to food versus they're lazy, like, you can then understand how to approach that to actually drive results. And I think about that piece a lot. Over the years, I've sat in interdisciplinary team meetings where we used to say, oh, this is a non-adherent patient. And when you just dig a little bit deeper under the surface, you find out, well, they're not taking their meds because they can't afford it. And guess what? Any one of us, if we couldn't afford it, we probably wouldn't take our meds. And so, like, understanding that. And one concept that I learned as a psych nurse was, if you think about, if someone does something that you don't like, think about it because they don't have the skill to do it. And I have just sort of like morphed that slightly to say, what is preventing them from doing it? And then you very clearly have an answer of what you're going to work on. So, and a lot of times it comes back to these Maslow's hierarchy needs. They can't afford it. They can't access it. They don't understand it. Like, these types of things, which are actually in some cases pretty solvable. But like, when we just kind of go in with the same tactic over and over, everyone feels like they're just bashing their head against the wall, and that kind of like fuels that stigma too, and it makes it easier to make someone the bad guy. But I think the easier approach is actually, just like we talked about, working with them, understanding them as a human being. What are those triggers? Is it a fear of going in public so they're not picking up their medications? Like, these are very real things that we see on a daily basis.
I think everything, whether we're talking about healthcare, sales, marketing, there's always got to be, you're always more successful when you have empathy, right? And if you can understand where they're coming from, and you actually listen to them, I think it's going to make things just way more effective, right? You're not going to be beating around the bush. You're not going to be, failing because of assumptions and all of that kind of stuff. So, when it comes to implementing a system, or marketing for healthcare, I try to put empathy into the core of that. I have 3 questions that are the starting point of my strategy, and you kind of mentioned it earlier, so I think you're going to be on the same page here. But I think about, what is wrong with me? How are you going to treat me? And then how am I going to pay for it? Right? There's 3 questions at the core of kind of any strategy. So I'm curious if you have a framework similar to that, how you strategize about going to take care of a patient, review the data, whatever it is, and how do you make sure that you're actually listening to the situation and providing the best solution?
Well, you don't know this, but you totally just like set me up perfectly, because one thing that we did as we were building our platform is we actually built this into the required workflow. So a portion of every interaction is going to be really dependent on who is the person, where are they, how are we progressing towards goals. That changes from interaction to interaction. But we have one piece that's called the conversation starter. And there's a compliance piece to this that might talk about HIPAA identification verification, or do we have a release of information if we're not talking to the person themselves? But then there's 3 questions, and these are the key that I think are so important. And what's on your mind today? What are you worried about? And what are you looking forward to in the next 3 to 6 months? And this is, there's a couple of different reasons we do this, but number 1 is this is the start of the call, and we're demonstrating that you are going to lead this effort, because whatever is on your mind is going to be the first thing we talk about. Instead of me diving into the list of to-dos I have, we're starting with you. The second is, if we don't address those things, the likelihood that the person is going to be present and capable of interacting with us is going to be almost 0. And then the third, again, it gives us the fodder for that aligned goal making. So what are the things that are important to them? How do we use that as motivation for them to continue working on their own health journey, et cetera? And I think these 3 things, again, are very helpful in the patient or member space, but they're also really helpful in day-to-day life. Like, what might that feel like if someone asked you that? You would feel cared for, you might get some questions answered, you might ask or share something that you probably wouldn't have unless you were like specifically prompted to do so.
That is so cool. I love that you have those questions and that framework. Can you do me a favor and repeat the 3 questions again, just so we're all clear?
Mm-hmm. What's on your mind?
Mm-hmm.
What's on your mind? What are you worried about? And what are you most looking forward to in the next 3 to 6 months?
Interesting. Okay. And has this been iterated on? Was there like a different question or a different way of saying it in the past that you've now changed to get to these 3 questions? Uh-oh. I think we're back.
Okay, we are. I'm so sorry.
No, it's all good. It could be me. It's part of the game, unfortunately.
It's not. I've been having internet issues this week pretty badly. So
that's fun.
did you get them?
What's that? Oh, I got them.
them?
Yes, I heard them.
Okay.
Yeah, it was perfect. My follow-up question was, I'm curious if this is like a version 3 of your 3 questions or something like that, if you've iterated off of this at all, or is this just like you guys all got together, came up with this, was like, we like this, it works, let's run with it.
Yeah, this is, I first came up with the questions in a previous job. They had a different iteration. But what I found is those were more health specific. And what I found is people sometimes had trouble answering those. And so what I wanted it to be is, what are things that are going to be forefront of people's mind and they don't have to think about, and they can just be honest. And I didn't want them to necessarily be constrained by health, because that sort of dilutes the intention behind it of understanding them as a human and not just like a patient or health goals. And so part of this was just really driven by this idea. I would look in a chart and I would see, patient says that they want to decrease your A1C. And I was like, did they really say that? Maybe one, 50 would say that. But most of the time what people are thinking about is, here's my life goal and here are things. And then it's our job to sort of translate that and say, this is how we think about your health and support that in order to make those goals more achievable.
Awesome. I love that. Cool. All right. So we're getting towards the end here. So I have 2 kind of just like large open-ended questions for you. We'll do one at a time to make it easy, but I'm curious if you could snap your fingers right now and have one, really detailed workflow or AI system implemented into your day-to-day to overcome some kind of issue or obstacle, what would that be?
Oh man, I think it would be just having an AI assistant with me at all times so I can remember conversations and keep my I don't know if I'd like that. It sounds good now, but maybe it would be horrible. I'm not sure.
Maybe if you had like a trigger word, you can tell it to start listening or something like that.
Yeah.
Awesome. All right. And then again, very open-ended and broad here. Do you have any predictions for healthcare and the integration with tech and AI? And, what do you think is going to happen in the next year, 5 years, 10 years, whatever it may be?
Yeah, I think that the tech is going to continue to emerge, and I think it's going to be a lot longer than we think before this stuff is regularly and consistently used in healthcare. I think going back to the fear we talked about, like a lot of decision makers are fearful. They worry about the accuracy of AI, which is a fair concern.
Sure.
And so I think that, as is typical for healthcare, we are going to be slow adopters, and there's going to be a lot of kind of push and pull, maybe some spurts forward, and then tons of regulations getting put in place, reacting to unintended consequences or things that weren't sort of anticipated. But I think I don't think it's going to be limited by the ability or expanse of AI in tech, but I do think it's going to be limited by people's egos, fears, anxiety around how it might impact their own livelihoods, those types of things. I think is going to slow it down drastically.
That makes total sense. Absolutely. I wanted to give you an opportunity. Is there anything that you are passionate about or excited about, maybe that we haven't discussed at all, that you wanted to kind of just share with our listeners?
Yeah, I think, obviously mental health, behavioral health is close to my heart. And I think there's some really exciting opportunity with AI in that space to kind of, again, bring up threads that maybe the therapist isn't hearing or hasn't noticed, and just provide that, almost like a Jiminy Cricket on your shoulder. Not necessarily talking to you about morals, but just saying, hey, did you notice this? Have you considered this? Is this a possibility? I think could be really, really interesting. And given the sensitivity of a lot of that work, I again think that that's a place where it may be slower to be utilized. But I think there's some opportunity to think about how can you implement those types of things at less risk. So for instance, not necessarily saving transcripts and just using them real time is one option. And there's some other ways that you can de-identify it and sort of get the benefit while mitigating some of those risks that a lot of folks have.
Well, I know mental health was kind of discarded for a while. They focused mainly on the body. So I think we've gotten better at that, but hopefully AI and this wave can help to catch that up even more and really support the mental health initiative. That's great.
Agreed.
Well, cool. So again, I know that you're at Braided Health. People can check you guys out at braidedhealth.com. I know that you are on LinkedIn at Emily Olson. Do you have any other like social handles you want to plug or anything like that? Or
Nope. Reach out if you love to talk about this stuff. I'm happy to nerd out with it with anyone for sure. Definitely love talking about it.
Awesome. Great stuff. Well, Emily, I really appreciate you coming on the Brainiac Blueprint. This has been a great conversation. Hopefully other people will find it exciting. And thank you, all you Brainiacs out there listening. Stay brilliant. Talk soon.
Thanks, Kyle.
Bye.
Bye.